Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to Health Matters, a comprehensive chat by the Islamic Medical Association, your regular Tuesday night medical slot to empower you and to give you information on various health topics. And tonight I'm glad to introduce Dr. Zubair Asmal, a nephrologist from Unitas Hospital Centurion. Assalamu alaikum, Zubair.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Alhamdulillah, alhamdulillah rabbil alameen, wal aqibatu lil muttaqeen, as-salatu was-salamu ala ashrafil mursaleen, Sayyidina Muhammadu wa alihi wa ashabihi ajma'een. We're discussing urinary tract infections tonight, a very common topic and something that I believe will be quite worthwhile. But since we're talking about a topic that presents very often with fever, I thought we'll quote a hadith Qudsi from the narrations of Nabi sallallahu alaihi wasallam. And it is said that Abu Huraira said that he went with Allah's messenger, visited a patient suffering from fever. And Rasulullah sallallahu alaihi wasallam said to the patient, "Rejoice with the good news that Allah subhanahu wa ta'ala says, I shall afflict my faithful slave in the world with my fire," in brackets it says fever, "so that he may be saved from his share of fire in the year after." And this is in Ahmad, also in Ibn Majah and Tirmidhi. And then another hadith, also a hadith Qudsi, when a slave falls sick, reward will be recorded for him according to what he was doing in his state of health. Narrated Uqba bin Amir radiallahu ta'ala anh, that the Prophet sallallahu alayhi wa sallam said, "Every deed of a day is sealed up, and whenever a believer falls ill, the angels say, 'O our Lord, your slave so and so has fallen ill.' Allah subhanahu wa ta'ala says, 'Note down to his credit the same deeds he was doing before his illness until he heals up or dies.'" And this is sound and reported by Ahmad in his Musnad. So obviously we try and keep to our Islamic teachings, and even in illness, look at the benefit and mercy of Allah all the time for us. Zubair, Jazakallah for coming.
Thank you.
And I want to discuss urinary tract infections. It's a common condition, and I think it gets overlooked when people like yourself come here as specialists. So Jazakallah for discussing probably a little bit of a mundane topic for you, but I think it's common and it will be useful. So perhaps let's start. What are urinary tract infections? And maybe we can get slide 1 up just to show the anatomy of the urinary tract.
So urinary tract infections is essentially what it exactly says. It's an infection of the urinary tract. And we find that if we can get the
slide up, slide 1, the next slide after that. Yeah.
And we can see from the slide that the urinary tract is made up of your kidneys, and then we have a pipe going down from the kidneys into the bladder, which is called the ureter, and then we have the bladder itself, and then coming out from the bladder we have another small pipe which is known as the urethra. So an infection of any part of the tract, so it can be an infection of the kidneys, or it can be an infection of the ureters, or an infection of the bladder or the urethra, would constitute what we know as a urinary tract infection.
And how common are these infections?
They're extremely common. In fact, if we have to look at the statistics, we find that urinary tract infections are the most common bacterial infections. If you look at infections overall, we find that the respiratory conditions, or infections of the the ear, nose, throat, and lungs are the most common infections. In terms of the second most common infections, we find that the urinary tract is the second most common infections. In terms of bacterial infections, we find that mostly the infections of the respiratory tract is usually viral. So that's why they constitute the most infections.
Yes.
But in terms of the bacterial infections, we find that the urinary tract is the most common infection.
So obviously you're referring to the type of germ that affects.
Yeah.
And then we find obviously that the urinary tract infections are more common in a female as opposed to the male.
Okay.
Is there any specific reason for that?
Before I tell you the reason, I just like to say that about 50% of women in their lifetimes will get a urinary tract infection. So that gives you an idea also of how common it is.
In females.
In females.
Right. 50%. That's quite a high figure.
they'll get it at least 50% will get it once in a lifetime.
Okay.
And from that 50%, you'll find that approximately about 20 to 30% will get recurrent urinary tract infections.
So they have some risk factors, but we'll come to that, right?
Yeah.
But in terms of the commonality, why more common in terms of females as opposed to males?
Okay, if we look at the why people get a urinary tract infection, what normally happens is that, if you look at the anatomy of a female compared to a male, if you look at the area at the bottom.
We have a slide on that.
There is a slide.
Slide 3, I think.
So this shows the urinary tract between a male and a female. And what normally happens is, your stools come out from your rectum. And normally your stools are filled with germs. And the most common germ which we normally get is a germ which is called an E. coli germ. And what happens with this germ is that somehow or the other, the germ comes out from the rectum and it travels up and it goes into the urethra. Or the urethra is the pipe which, where the urine comes out. And then the germ basically ascends, or it works its way up to the bladder where it actually causes an infection. Now, if you look at these two slides, you can see that the distance between your rectum and the pipe where the urine comes out is very, very short in a female. Whereas if you look at it in the male, we find that, the distance is actually quite a distance. And you find that the scrotum actually, prevents it from actually entering the pipe.
So the male's anatomy protects him relatively.
The male's anatomy actually protects it from actually getting a urinary tract infection. We also find that the pipe, the male pipe leading from the bladder to the outside is much longer than the female pipe.
Right.
So it's much easier and it's got shorter distance as well going into the bladder.
Okay.
And that's the reason why, we find that infections are more common in females compared to males.
Okay, so we've established that, and therefore you mentioned earlier that there's some risk factors involved in terms of why people get urinary tract infections. Some females get it only once in their lifetime and others get it multiple times. And what exposes them to these repeated or even the once-off infections?
We're not exactly sure why some females get it and why some females don't get it.
Right.
It might be because of the anatomy, it might be genetic factors, it might be personal, hygiene, which has to do with it as well. But the obvious risk factors of getting a urinary tract infection is one is you being a female.
Okay.
You're more prone to getting it.
Right.
There is a slide, I think.
Slide 4.
So in this slide, we can basically see, people who have these risk factors are essentially more prone to getting, the urinary tract infection. So we find that, like I said, if you're female, you're more prone to getting it. There's certain age groups which are more prone to getting it, and we find that you tend to be more protected towards the extremes of ages. So we find that, children is very, very rare. In the elderly, it's common, but not as common as, in adults.
Would you say it's more common in the reproductive age?
Oh, definitely.
Okay.
And you can see there, one of the risk factors is, having sexual intercourse,
Okay.
and being pregnant. So, because of that, it's more common in the reproductive age as well.
Okay.
Once you reach menopause also, we find that there are certain reasons why, the urinary tract infections are more common. And we think that it's got to do with the lack of estrogen. It changes the flora, or the bacterial counts in the vagina and in the rectum itself. And then there are other risk factors as well. For example, patients who have spinal cord injuries who are unable to urinate normally. In males who have enlarged prostate, they might also be diabetic patients are also more common. And then patients who have usually some procedure which have been done, on the urinary tract are more prone to getting it as well.
You touched on males, so are you saying that it's more common in a male that has, in a more advanced age, when his prostate is becoming a bit enlarged? In males specifically, now we're not comparing to females.
Yeah. With males specifically, if you have a urinary tract infection, there's something else going on because
so it's not your anatomy.
It's usually something wrong with the anatomy, right? But we need to investigate and find out what is wrong with the anatomy to actually cause the infection because we've been protected, with the natural anatomy.
Okay.
So usually, if if a male gets an infection, okay, we need to actually look and find out now why is a male getting an infection? Is it because of his enlarged prostate? Maybe perhaps he's got a tumor sitting somewhere, or maybe he's diabetic. He might have one of these risk factors, and we actually need to look towards these risk factors to actually try and find out why is the male getting an infection.
So you're saying that when a male gets an infection, you'll explore a bit more vigilantly as compared to a female where it's expected.
Yes, yeah.
Okay. All right. So the next thing, obviously, patients will present with certain symptoms and will complain of certain symptoms. And I've mentioned fever as being one of them. What are the common symptoms that patients must be aware of that could alert them that they could be developing a urinary tract infection?
I think the symptoms which patients present with, usually depends on the age of the patient.
Okay. Mm-hmm.
So look, I'm not a pediatrician, and I don't know anything about babies.
Yeah.
But generally, if a baby has to have a urinary tract infection, or if he has to have an infection of the bladder, then they present. Okay, one, they can present with fever, but then they present with irritability. They present with they're not eating properly, they're not sleeping. Neonates, they'll present with jaundice. They can even present with diarrhea. So they present in a very unusual manner.
That's
so
kids.
those are kids.
Yeah, okay.
In adults population, and now when I'm talking about adults, probably between the ages of from about 10 to about 50, 60 years old, they can present with fever as well. Then they present with what we call an increased frequency. So every now and then they go to the toilet and they start urinating. They can present with what we know as urgency, which means that every time they sit down, they feel like they want to go to toilet, and when they go to toilet, they urinate very, very little.
Low volume.
Low volume.
Okay.
When they urinate, we find that they can either present with pain on urination, or they can find that the urine is very, very hot. So what we know as burning on micturition. Sometimes they can present with with flank pain, with pain in the back as well. And I think those are the main symptoms which
Those
they
are more
present.
common symptoms.
So essentially, if you have fever, if you have burning on micturition, and if you have increased frequency or urgency, most likely you have a urinary tract infection.
Okay, so that's very valuable information to take the discussion forward, but we'll do that after the ad break, so please stay with us and we'll see you shortly. Assalamu alaikum. Assalamu alaikum. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. Tonight we have Dr. Zubair Asmal, a nephrologist from Centurion Unitas Hospital. We're discussing a very common condition, urinary tract infections. We're concentrating mainly on the adults, but we have touched on kids. Just before we took the ad break, we spoke about symptoms that you can present with. They're fairly common, and but they are the elderly that actually present slightly differently. Zubair, is that correct?
Look,
a bit of a variation from the normal presentation.
You see, normally, like I said, when adults present, or when kids present, we normally present with fever, and you present with signs or with symptoms which tells you that there's something wrong with the urinary tract.
Yeah.
Now, with the elderly, what sometimes happens is that all they can present with is just a little change in their mental status. So they might be confused just a little bit, or you might find that the elderly. They might have a little bit of hallucinations, or sometimes they can present with diarrhea, and it's actually a urinary tract infection, with no fever at all.
Okay.
And sometimes we get caught out because say for example, an elderly person comes to us and he presents with diarrhea, for example, or confusion in. As a doctor, if someone presents with confusion, you think something is wrong with the brain. So, you sit and you do, scans of the brain, and you do scans of the neurological workup, and in fact, the problem is with the bladder. So, elderly generally present, in fact, most infections, even pneumonias, urinary tract infections, the elderly tend to present more with confusion and behavioral abnormalities
changes.
rather than the actual system which we normally talk of.
So we must be aware of that, and I think it's a very important point that the elderly present differently. And while obviously you will investigate fully, but then look for more common things
more
too.
common things, and
The lines will be open shortly, and the number will appear on the screen at the bottom. But please do start calling in on 011 086 7700 or 1 or 2 or 3. And we hope that you can ask Dr. Zubair Asmal some questions on urinary tract infections that you've been wanting to ask for a long time. But while we wait for your calls, obviously Zubair, so patient comes in with symptoms. As doctors, the next thing we look for certain signs and we try and make a diagnosis. What would be the next step?
So usually, a patient will come to you and sometimes it's fairly obvious, if they come to you and they tell you, they've got a fever, I've got, my urine is burning, I'm going to toilet all the time, then you know that, the diagnosis is fairly simple and you can make it quite easily. But if you really want to confirm the diagnosis, then, we can do certain tests. For example, we can test the urine itself. And there's two ways in which we can actually test the urine. The one is, with the simple dipsticks, where we can actually just look in and see if there is any infection in the urine. And the second way is where we can actually take the urine sample and send it off to the laboratory. And they can look and see, if there is any infections in the urine itself. In terms of examining the patient, you might find that if you touch their abdomen, they might be a little bit tender, in the lower parts. If you might find that they might be a little bit tender in what is known as a renal angle, which is, at the back of the back.
I want to interrupt you there. Patients come in and they say, my kidneys are sore. And then they're pointing to the back. And sometimes that's all they come with. Is presentation of pain in the back a common presenting feature of urinary tract infections?
Not really.
Okay.
Look, it can present with pain in the back. Usually, if there is pain in the back and it's associated with fever, we tend to think of a more sinister infection. So then probably you might have an abscess or something sitting in the kidney itself. There's lots of causes for I'm sure you see patients all the time who come with lower back pain. There's a whole differential of what causes pain in the back. And usually it's just something, it's either muscle pain or just a ligament which has been stretched or something like that.
Okay, good point. We got a caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Hello.
Hello, assalamu alaikum.
Alaikum salam. I'd like to ask a question. I received. Alaikum salam. I received some.
Yeah, you can just don't listen to your TV. Turn your TV down and then you can ask the question, brother.
Yeah, okay. I'm away from the TV now.
Okay.
Yeah, the question I like to ask is, I received pains here between my bladder, and I went to the doctor about 3 weeks ago, and then he put me on an antibiotic for 10 days, and then after the 10 days, the pain just started coming back, and it was totally severe. Then what I did afterwards, I detoxed. I used some of these remedies which I can just flush out my kidneys and extra salts, and then the pain was a little bit mild, let's call it. So basically the pain comes and it goes. So I just like to find out what is it, especially what is it, because I'm urinating a lot.
Are you diabetic?
No, I'm not diabetic.
Okay, Zubair?
Can I just ask, how old are you?
4.
How old are you, brother?
44.
44. Okay, look, what it sounds is, and obviously, we need to do a little bit more investigations to see, what is going on. But like I said before, if a male gets a urinary tract infection, then it's not normal. Something is going on. And from what you're trying to tell me, or from what I'm hearing, obviously, we have to do more tests to actually, make sure that this is the case. It sounds that you've got a prostatitis, which means you've got an infection of the prostate.
Okay.
Now, normally, you see, the prostates are quite notorious in a sense that, the infections take a long while to clear. Sometimes you need to take, antibiotics for about 3 to 4 weeks before the infection actually clears.
Okay.
So
Yeah, because what the doctor said that I need to come back next month just to draw some blood so that we can check the prostate, because he checked my urine. There was no infection or anything on the urine.
Yeah, look,
Yeah, so
like I said, you probably need to see a urologist who can basically, have a look at your prostate and your bladder,
okay.
and have a look at it and see, what is actually going on, because you're obviously having some urinary symptoms. In a male, we need more investigations to try and see what is going on. It sounds like you're getting repeated infections. Once you clear it up a little bit, and then you're getting another infection on top of it. It clears up, and then you're getting another infection. So in these cases, we tend to give prolonged courses of antibiotics, because sometimes the antibiotics that we use doesn't penetrate into the prostate itself. So we need to give prolonged courses, and to try and deal with the actual problem. What's actually causing the problem.
Okay, so Jazakallah, Dr.
You're welcome.
Jazakallah for the call, brother. A very good question there. So you find this happening, eh? That males coming in with recurrent infections.
With recurrent, very, very, very common. Very, very common. We find that, other signs of prostatism is that, sometimes you go to toilet and your stream is not as good as it normally is. So you go, the urine comes out and then it stops, and then it comes out and then it stops, and then it comes out and then it stops. And the actual stream is very, very weak. That's a sign that that you might have some prostatism. Okay. And I think in those cases, it's wise to actually see a urologist, so that they can actually make the diagnosis and give you some medications for it.
Okay, I think we have another caller. Assalamu alaikum.
Wa alaikum assalam. I've got a question.
Go ahead.
I was recently circumcised because of religion, Allah, to please Him. And 2 weeks later, I've got quite a big lump about the size of my fingernail underneath the skin. I went back to the doctor. He said it's a blood clot, and he pressed it for about 2-3 minutes until there was nothing there. And by the time I got home, it was back and it's still there. Will it dissolve by itself?
Sure.
It's a surgical question.
First of all, I can hear the pain that you went through when you went to the doctor.
No, I had no pain.
Okay.
Not one single bit. Not a second of pain.
No,
not even discomfort.
Okay. Look, what I would do is basically, it sounds like you might have had it might be a small hematoma sitting there, which might go away on its own, later on.
Right.
Or it might be a small cyst or something which might be also sitting there,
He said it's a blood clot.
What color is it?
Oh, it's under the skin. I can't see. Unless I cut myself open. Sorry, brother.
Yeah, so it's not superficial, right? You're saying it's underneath.
No, it's underneath the skin.
And does it feel like a lump?
It's a lump. It moves around very easily.
What I would do is, maybe go and see a urologist as well, just to have him have a look at it properly. Sometimes they can cut it out and send it off to the laboratory to try and see what it actually is.
Well, it's only come up since the circumcision.
Yeah.
About a week after.
It's difficult to say, on the TV show what it is without actually having a look at it. But the other possibility, which I'm just thinking on the top of my head, is it might be what we know as a keloid, which is a scar tissue, which is basically an excess of scar tissue which is formed, post circumcision. But I think maybe go and see a urologist and let him have a look at it and see what's actually going on. Like I said, you know what, it's difficult for me to say, and I'm sure,
Yeah.
you know, being a Muslim program, you can't send any pictures or anything
Yes.
as well.
The doctor actually specializes in this,
Okay.
and he said it's just a blood clot because it moves around very easily.
But did he say it will resolve on its own? Did he ask you to come
He
back for
said-
a review?
He said he said he will press it, and he did for a few minutes, and then it disappeared. And he said, but if it comes back, then basically it will disappear by itself. But I was just asking because I've got two qualified Muslim doctors who I appreciate, and I thought maybe your advice would be welcome.
Yeah, I think Dr. Zubair is correct in saying that because it's a physical problem in terms of it being a lump and it's not something that can just clear out without actually seeing it, and you're not feeling any pain, so it's unlikely to be an infection. Sometimes an abscess can develop, but then you would have had a lot more pain. So what you need to do is obviously a post-surgical complication of some sort. So I think go back to the doctor, and I don't know the time period since the last time you've been to him.
4 or 5 days.
Okay, so maybe give it another 2-3 days and then contact him again to see if there's complete resolution or not.
All right.
Okay.
Thank you very much for your advice.
You're welcome. Jazakallah. Assalamu alaikum. Zubair, we were discussing the urine test, right? What we found is many times there's different types of these urine dipstick tests that the doctors are using. And are there particular urine tests that are a bit more reliable? Because you find a patient getting, we look at different color changes, right? We got a caller, we'll come back to that, right?
Okay.
Assalamu alaikum. Assalamu alaikum. Assalamu alaikum.
Hello, doctor.
Yes, you can ask your question, sister. Assalamu alaikum.
Okay, I have a problem. I went to the doctor, I think about 3 weeks ago. My problem was my lower back pain, and then already to the abdominal pump. But now the doctor gave me antibiotic, but the pain now is still, I still have a pain. It's not in the lower back now. The pain is in the upper back. So I don't know, maybe it's the TI or what, because the doctor said no, the TI. And she checked my urine, no leukocytes. The urine is clean. But my urine is burning. Also, if I use a sexual, I have a sex, it's also painful. But when I'm urinating, it's not burning, it's not painful.
Okay, look, if you got, maybe I can, I can join the question which you are asking with the question which you were asking as well.
That's right, yeah.
You find that what happens with the urine dipsticks is that when you normally do a urine dipsticks, there's 3 components which you look at, to diagnose an infection. The one is a white cell count, the white cells, whether there are white cells present. The second is whether there's nitrites present, and the third thing is whether there is, the leukocyte esterase. Those are the 3 main things. Now, the nitrites might only be present if there are nitrite-producing organisms which actually cause it. So it might be an E. coli, which is the normal one, which is the case in 90%. But we might find that sometimes it might be another organism which is causing the urine, and in those cases, you might find that the nitrites and the leukocyte esterase might actually be negative. So in the case of the caller, it might be that you might have an infection which might not be producing the nitrites, or it might not be producing the leukocyte esterase. So in that case, what I would normally do is, in this case, you need to send the actual sample off to the laboratory to make sure that there's no infection. So what they'll do is that they'll take your sample, look at it under the microscope, see if there's any germs or anything, and then they'll actually culture the urine specimen to see if there is an infection. If they do that and they find that there's no infection, then you can rule out whether you have a urinary tract infection. And then obviously you need to look at other causes of what's actually causing your backache. So, like I said, you know, if you have backache, there's lots of causes, and you know, maybe your doctor then needs to look in another direction to try and find out, you know, what is actually causing it. So,
Does it answer your question, sister?
Okay, so I'm going back to my doctor tomorrow.
Yes, and then you're going to get the urine to be sent off to the laboratory if the doctor doesn't pick up an infection when he tests it. So in other words, you need a few more tests.
Yes, you send it to urine to the lab. I'm going to take the results tomorrow.
Okay.
oh, okay.
All
No,
right.
that's,
So inshallah, then you can take it from there.
Take it from there then.
Jazak.
So it looks like your doctor has done the correct thing. So maybe go and see your doctor again, you know, and then he'll tell you whether there is an infection or not. And if there isn't an infection, then he'll look at the other causes of, you know, what's causing the backache.
Oh, okay. All right. Thank you very much.
Okay, Jazakallah. Assalamu alaikum. Okay, I think we'll go for an ad break. Callers are very good questions coming through. Please do call in immediately after the ad break. We'll still have a few more minutes with the lines open. Assalamu alaikum.
Then you need to do something more.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat. We have Dr. Zubair Asmal, a nephrologist from Unitas Centurion with us, discussing common conditions of urinary tract infections. We've had some very good calls. Please do call in. We have a few minutes left. The lines are open. The number will be at the bottom of your screen shortly, 011 086 7700 or 1 or 2 or 3. Zubair, so we spoke about the actual diagnosis. The most important thing is obviously managing the condition.
Okay. I think, you know, when you get a patient with a urinary tract infection, what you need to do is you need to classify the patient. So basically there's 3 categories in which we classify a patient in. The first one,
slide 7, classification.
So the first one is asymptomatic, you know, bacteria, asymptomatic, what they known as asymptomatic bacteriuria. In those cases, we tend to do nothing for the patient. You just leave them alone. And although there are certain, you know, groups of patients in which, for example, a pregnant patient who comes in, you need to treat that patient, even if she is asymptomatic. Then the second group, or the second part of the classification, is an uncomplicated urinary tract infection. And to all practical purposes, you know, this is a young woman who's in childbearing years and who has no other, you know, medical conditions, and she's not pregnant. Okay. In those patients, you don't really have to do any investigations or anything. You can give them an antibiotic for 3 days, and that should clear the infection itself. And then the last group is, so that's, you know, everybody else besides the young female. For those patients, you tend to need a longer course of antibiotics. And I think in those patients, you need to actually find out what the cause of the urinary tract infection is. A good example of that is obviously, you know, we spoke about the males. You know, if a male comes in with an infection, he falls into the category of a complicated urinary tract infection. So you treat him for a longer period of time, and then you do investigations to actually see what the cause of the infection is.
Okay, we'll come back to that. We have a caller. Assalamu alaikum.
Wa alaikum salam. It's Shireen speaking. I just wanted to find out something. I actually suffer with rheumatoid arthritis, but I've found that I've had recurring urinary tract infections, and I've been on different antibiotics. I've been on several Unitin medications, and it would clear for a week and it's back again.
Okay. Look, there's no real association that I know of, you know, with rheumatoid arthritis and urinary tract infections. What I can think of on the top of my head is, you know, whether do you use lots of painkillers, you know, to...
You know what it is? I've been on biologic treatment.
Okay.
So I was informed some time ago by a urologist that this was possibly a side effect from the biologic treatment that I'm on.
Okay.
And I've subsequently stopped the biologics, and I've found it's a month now that I'm still getting this on and off, on and off.
Okay. Look, what I would say is that, look, like I said, you know what, if you are on biologics and, you know, your immune system might be, you know, quite down, and that's the reason why you might be getting the urinary tract infection recurrently. It's also quite common, you know, for females sometimes to actually get recurrent infections. And, you know, we need to look at the reason why. Now, normally what happens is that we normally go through a process. And what we normally do is that, you know, if you get an infection, we normally treat the infection. If it comes back after, you know, if it comes back again, we treat it again. And then, I don't know if your doctor told you about, you know, ways of actually trying to prevent getting a urinary tract infection. And the things what we normally do is that, you know, we say that when you go to toilet, for example, and you wipe yourself, you must wipe from the front to the back. You know, so you decrease the chances of, you know, germs entering from the rectum. The other thing is
See, what has happened as well is that because it's been going on for like 4 months.
Okay. If it's good.
And I said to them, you know, they had to make the decision, try and deal or live with these ongoing infections or stop the biologics. So we took the decision to stop the biologics.
Yeah.
And it's now a month, and it's obviously it's on and off. But the other thing that I need to say to you is that I can't seem to find, firstly, something suitable medication for this. We've done the P culture test, you know, which is the one that they check to see whatever's going on. She diagnosed an antibiotic suitable for her findings, and it just doesn't seem to be.
Can I ask you which antibiotic she put you on?
I don't have that offhand.
Okay. What I would
Zenet. That's your cephalosporin.
yeah. No. What I would do is look. If you're getting it after 4 months, you know, continuously, then I would be on what we call prophylactic antibiotics. You know, and I would take that for about a year. You know, to actually prevent you from And the antibiotics we tend to use is we can use Bactrim, you know, for a year, maybe 2 tablets every day. Or there's another antibiotic called macrodentin, you know, which you can also use every day. Or, you know, there is another medication which is called fosfomycin or urizone. And, you know, that's what you can do is you can take that one, you know, once every 10 days. If you're getting recurrent urinary tract infections, and you know, there's no reason why you should be suffering with this, then what I would do is, you know, maybe go on to prophylactic, you know, antibiotics for about a year or so and see if that helps. If that doesn't help, then, you know, I would go and see a urologist again, you know, just to do a cystoscope, and, you know, just to make sure that there's nothing else going on. Having said that, you know, I just want to make sure that, you know, I think your doctor also needs to make sure that what you are actually experiencing is a urinary tract infection in the first place, because sometimes, you know, a doctor might just do a dipsticks or something and find that, you know, there's blood in the urine and confuse that with a urinary tract infection, whereas you don't have any symptoms. If you don't have any fever, if you don't have any burning while you're urinating, if you don't have any pain, I would probably not do anything, you know, probably just leave it. That would fall into the category of, you know, asymptomatic bacteriuria. You know, so don't do anything.
Because there is no burning or pain. And that's what I found strange, because although she says that the results were positive, and it said she indicated that it was bacteria.
Yeah.
So, sister, what we suggest is you must perhaps go back to the doctor and just tell him, perhaps look at and review the thing if it's really a urinary tract infection. And if it is one, then you, as Dr. Asmal has said, that you must go on to a long-term treatment for at least a year, which is more like the prophylactic managing a long-term condition. So make sure it's a right diagnosis and then do the appropriate thing. And I hope, inshallah, that you can come right with that. And Jazakallah khair for your call.
Jazakallah for the response.
Okay, no problem. And we actually have come to the end of the program. don't even have enough time, Zubair. But this is what happens. The whole thing is we want the callers to call in, and hopefully we've empowered them, we've answered some of their questions, and I hope you've benefited from this. We can perhaps come back to this topic. We didn't get even to the antibiotics. So maybe we can do another program discussing different ways of managing urinary tract infections. And Jazakallah khair for coming, Zubair. And really, we hope to have you back on the show.
Jazakallah for inviting me. It was a good experience.
Jazakallah for the viewership. And next week, Health Matters will be back with psychiatry with Dr. Shahida Umar and Dr. Jiva. So we hope to see you here on our regular slot again. Assalamu alaikum wa rahmatullahi wa barakatuh.